Good morning, and welcome to this Milken Institute webinar on Healthtech and amid the COVID-19 pandemic. I am Cesar Purisima, and I am an Asia Fellow at the Milken Institute, a global nonprofit, nonpartisan think tank helping people build more meaningful lives. The Milken Institute has long focused on the Philippines as one of Southeast Asia's leading emerging markets. We previously convened roundtables in Manila on infrastructure investment and fintech adoption, and more recently turned our sights towards health tech. We had originally scheduled a health tech for universal healthcare roundtable in March of this year, but were forced to postpone it due to the pandemic. This webinar is a continuation of the Institute's engagement in health tech in the Philippines, and we hope to safely convene key stakeholders for this roundtable in Manila by 2021. Health tech has long been a topic of interest as the world undergoes a period of rapid digital transformation. In countries where public investments on health and social services are constrained, the need for innovative technologies in the health sector to bridge the gap dramatically increases. In the Philippines, the doctor-to-patient ratio is 1 to 33,000, much lower than the global average of 1 to 6,600. Health tech can enable many aspects of Philippine healthcare to be cheaper, better, and faster. Where doctors are scarce and hospitals overcrowded, telemedicine improves access and relieves capacity pressures. Where geography impedes the distribution of physical resources, digital consultations and diagnosis can step in. Where patients have high out-of-pocket spending, insurtechs can offer price comparisons, tailored premiums, and hastened payouts. The strength of the Philippine health system may rest on how well its technologies amplify scarce offline resources. COVID has accelerated tech disruptions across many sectors, and healthcare is no exception. This pandemic is a ripe time for embracing health tech transformation. At the Milken Institute, we are continuously asking how the health tech investment, innovation, and adoption curves can be steepened and how its challenges can be addressed in developing countries. Today, we are excited to hear and learn from an all-star panel of experts and thought leaders on this subject with the highly esteemed Dr. Jeremy Lim of the National University of Singapore helming today's session. In the meantime, the Institute continues to do its part by making key resources and information on COVID-19 freely accessible. This includes a global vaccine tracker by our Faster Cures Center in the US and an Asia coronavirus timeline covering 7 markets in the region. Public webinars like this are also recorded and posted online, free for your perusal. With that, I'd like to thank you all for joining this morning, and will now turn it over to our moderator, who is actually on the road and proving that health tech works, Dr. Jeremy Lin. Thank you.
Thank you. Thank you, Caesar, and a very good morning to everyone listening in. I must assure you that I am not driving and it's perfectly safe. So if the video goes off, don't worry. It's just a connectivity issue. Nothing bad has happened. And I see that Matt is also on the road. So yes, that's the joy of technology. We are always connected, and this really creates a lot of opportunities, as really Caesar mentioned, and particularly in an archipelago nation like the Philippines, where access tied to quality can be challenging, because very realistically, we as doctors don't actually like to live in difficult conditions, and it's very hard to persuade doctors. So the traditional models of really compelling the recently graduated doctors to serve in remote areas, which has been very unpopular with the doctors, and often operationally it gives rise to lots of ground challenges, may be ameliorated somewhat by the advent of technology. And I think it has been said that COVID-19 has really accelerated what we thought would take a decade, and it's now been accelerated in just a couple of months. So And it's just challenge not just for the Philippines, but it is a global challenge. And I am mindful that despite the WHO convening a very ambitious seminar in Alma Ata in 1978, proclaiming we'll have health for all by the year 2000. Well, 2 decades have passed since the year 2000, and we're actually not much better off. The World Bank and the World Health Organization put out a seminal update on universal coverage 3 years ago, where it reflected very sobering statistics. Firstly, that half the world, that's just under 4 billion people, still lack access to essential health services. We're not talking about the high-fangled, really latest devices coming out of the US, but it's just really essential healthcare services, primary care, vaccinations, and really so on. That's half the world. And just as importantly, the report also noted that 100 million households around the world fall into bankruptcy due to healthcare reasons. So the world as a whole is not doing well when it comes to improving the accessibility as well as the affordability of healthcare. And perhaps COVID-19 silver lining is that it helps to accelerate the advances in and the adoption of really technology. Maybe can I start with Manuel and ask, we've always had tele consultations for the last 2 decades. And I also remember when I was in Hopkins almost 20 years ago, we were using telemedicine so that the professors could attend conferences in one state and see their patients back here in Baltimore. But the adoption has been very slow. Could you talk about the situation in the Philippines and advise us on what are some of the system challenges that have caused the readiness to adopt really tech to be somewhat limited? And maybe Manuel, over to you.
Good morning,
Great.
and good morning to everyone. Well, Filipinos haven't really adopted to telemedicine very much. And I think it's because they're used to wanting to see their doctors personally. Even if they have to wait long lines in clinics, they'll wait so that they'll meet the doctor even for 5-10 minutes. I think maybe it's a habit, it's a cultural thing. But what has happened with COVID-19 is that many doctors have actually moved into telemedicine. And I know among my classmates, they're doing telemedicine. I have a group of students who actually did a research project on telepsychiatry. And they interviewed psychiatrists who actually said that, in a sense, they were forced to go into telepsychiatry in order to be able to maintain their practices and to continue to be in touch with their patients. Now, this had upsides and downsides. Okay, there was a point of skin hunger. They weren't seeing their patients. There were issues about connectivity and issues about not being able to be there to be emotionally connected to their patients. But nonetheless, they said they were able to do their consultations, and many of the patients actually were quite happy about these consultations. And therefore, to make a long story short, I think COVID-19 has moved us into that new platform. I think that will probably be maintained to a certain extent even after the epidemic ends. And there will be some doctors that will be continuing to do telemedicine. But I think by and large, for now, the norm is to see your doctor personally, to have that personal connection with him or her.
All right. Thank you, Manuel. And very interestingly, here in Singapore, patients actually seem to prefer teleconsultation for psychiatry. And the reason is that they can see the doctor's face. Whereas if it was an in-person, quite ironically, they feel more detached from the doctor who is fully gowned up with an N95 mask, and even though they are in the same room physically, but that emotional connect, somehow it seems to be better done remotely where you can see each other's faces. And the psychiatrists also report that they prefer teleconsultations because they can see the patient's facial reactions much more really clearly than if both parties were really wearing masks. So that's an interesting phenomenon in really telepsychiatry. can I turn to Christian and ask, really, despite some of the challenges that really Manuel had essentially articulated, what are you seeing on the ground? What has AC Health been doing? What are some of the challenges that you have encountered, and how have you been overcoming them? Over to you, Christian.
Thanks, Jeremy, and good morning to everyone. Well, like Dr. Dayrit already pointed out, like one of the challenges really like, with the lockdown in March, mid-March, right? Patients, consumers were no longer able to go to the clinics. A lot of our mall-based clinics, like Healthway side, were closed to the lockdown as they're located in malls, right? A lot of people also were fearful of going into healthcare centers, right? Because they were worried that they contract COVID-19 there, right? A lot of hospitals or primary care centers like ours, they were still trying to figure out how to actually cope with the COVID-19 crisis in their respective outlets. So we started on quickly to launch a free telehealth service, which gained fantastic traction together with the DOH, which really put forward a call to arms, so to say, like, please help us to help all the patients in need with like free teleconsultation using technology, electronic means, be it a simple telephone call to a doctor or a hotline, or be it more sophisticated tools like video chats and so on. Since then, we actually made this part of our regular procedures. So our clinics and healthcare centers are open again with all COVID-19 measures in place, social distancing and so on. But we still have pursued that digital path that led to a spin-off, Health Now, where we're really now doubling down actually on that digital health endeavor and trying to figure out how we actually combine these two worlds, right? I agree with every doctor who says that certain encounters need to be happening in person, right? Not everything can be done digital. Some patients will prefer an in-person encounter. Others, and that we've seen in our statistics, younger patients, they don't really care to see the doctor in a physical setting. They're completely fine at their own schedule and convenience to see a doctor to get their questions addressed, get a prescription fulfilled, and then they move on with their day. So there it's really convenience what drives it, while for more elderly patients, they really have built-in relationship with the doctor and they like to seek that happening in person, right? We see a shift that people are more open to technology. I think the next step for us is to how do we merge these two worlds to have the best outcome.
And maybe, Christian, it's quite ironic that the patients who would benefit most from a safety point of view from really teleconsultation, the seniors, especially those with chronic conditions, are also those whom, as you pointed out, are least really receptive. Maybe before we move on to really Matt, could you say a little about physician behavior? Is it likewise that the younger doctors embrace teleconsultations, or is it that the older doctors, because they're at higher risk for a poor outcome following COVID, that they are also keen on? Yeah, please go ahead.
It's a good question. So looking demographic-wise, younger doctors, Jeremy, no doubt, embrace technology. In particular, like they don't have to go into the clinic. They don't have to take up a clinic in a hospital, which is a common thing in the Philippines, that you rent a clinic in a space, and that has a huge financial impact. Telemedicine or telehealth completely allows you to set up your clinic at home and still serve a large pool of patients. The older doctors, more experienced ones, so we still need them in the system because to provide that know-how. They were a bit slow to adopt technology, but we did like daily call outs to them. We had video sessions with them, walk them through the platforms and so on. So it's really more a hands-on approach for that kind of market segment. They're embracing it though. They understand the benefits of it. They can also serve more of their patients from their respective clinics rather than travel through the various clinics in Metro Manila to see these patients. I do think they also slowly but steadily adapt to it to find the point where they can integrate this technology in their practice. It is just really more a matter of slowly bringing them to this technology, but the benefits are clear to them as well. And I think in the long term, it will be nicely adopted also by the more senior segment of healthcare professionals.
Oh, no, then that's really good to hear. And I think that the younger doctors will also save a ton on clothing and laundry. You might find that the scrubs the young doctors like to wear, you will find that you need many more tops and not so many pants. But let's move on to Matt. And maybe Matt, could you share a little about the China story and how China had embraced the use of technology and really managed to overcome COVID relatively quickly. And now, even as North America and Europe are facing resurgences, China seems to be well on top of things. Could you say something really about that? Thanks.
Sure. In China, actually, people adopt internet hospital or telemedicine pretty early. As We Doctor is one of the largest platform in China, we have 210 million patients online and users online, and we have 250,000 doctors on this platform, connecting 7,200 hospitals nationwide. Now, the real adoption of people using this heavily is the COVID-19, during the COVID-19. We have seen a surge of usage of this platform. I give you an example. During the lockdown of Wuhan city, government actually sent physically, right, 50,000 healthcare workers to the city.
Yes.
But people don't know that we actually organized on the platform, okay, on the internet platform, another 50,000 doctors to support the city. So the people, in the city, when they get sick, they do not go out to the hospital. They just use the internet hospital and doing the consultation and also diagnosis online with the doctors online. That actually help the system offline. Okay.
Yes.
Now, during that phase, the government or the internet hospital quickly find that most of the patients that need the social health care, social insurance payment to be directly payment online. That is I would say, a bottleneck before the COVID-19. Okay, people have to doing the reimbursement offline, but during the COVID-19, people are scared to go out to do the payment offline, right? So it has to be done online. And
so it's all integrated.
All integrated, and during this COVID-19, before that, people just doing the consultation online, but still the payment is offline, right? That's one side. The second side is during the COVID-19, people saying that the telemedicine is most used for the chronic disease patients. Okay.
Yes.
Those patients stay at home, but they ran out of drugs. Okay, the medicine, and they have to get the prescription refilled. And they do not go to the physical. Normally, they go to the physical hospital offline to get that refilled, right?
Yes.
But now it can be done online. And then once this habit has been built, created, then people are starting using online more frequently. Okay. And another side benefit of this is that if the internet hospital is being used for the prescription refill, you basically can do the mass procurement of the medicine because this is all concentrated through one channel, right? And the drug price dramatically reduced actually through the volume purchase.
Okay.
So this is some, I would say, some of the aspects of the China aspect for fighting against COVID-19. Yeah.
Matt, could you say something about how doctors in China examine their patients remotely, and also how laboratory tests are done?
Yes. So there are a wearable device, and also certain devices were equipped with the We Doctor platform. We have the so-called, people are familiar with Google's smart speaker, but we have the smart monitor, at home. And so the doctor can talk to the patient face to face, like us, video conferencing. That's one set. Secondly, those devices are through the Bluetooth linked with the simple, I would say simple devices. Okay, like measuring your temperature, your blood pressure, even actually the sugar rate of concentration of your blood. Okay, so and the oxygen rate of your blood. Those are simple devices that come with that monitor. Okay, and certain equipment manufacturers also, like Huawei, etc. They also manufacture the wristband, etc. that attach to your skin and be able to read out those numbers for the doctors, right? Now, for sophisticated exam like CT, MR, PET scan, and the blood test, you have to go to the offline centers close by. So on the platform, we basically have the physical examination centers or third-party centers actually join this platform. And when the online hospital, online doctor prescribe a prescription for the examination, the patient will go to those centers to have them examined. Yeah, and also the digital form of the results get transmitted to the center. Yeah, so to avoid the repeat examination. Yeah.
Ah, I see. All right. No, that's really very interesting. And can I turn to Joseph, who has a much more global mandate to look at the latest really technologies? And can I ask Joseph specifically, what else have you seen being deployed during COVID-19 beyond virtualization? And what you think is possible? Because at least to me, as a health systems really academic, it would be hugely disappointing if really all we did through this crisis, and as they say, never waste a good crisis, if all we did was simply to take physical consultations and move them online. But we're also accumulating a lot of data, we're understanding a lot about population health. So what else have you seen, and what's on your wish list? Joseph, over to you.
Thanks, Jeremy. And I think you partially started answering the question where we are starting to look beyond the actual patient. I think the one technology that we've all been familiar with now is, the vast suite of contact tracing applications to make that much, much faster. And you've seen different permutations of this going around the world, going from, the QR code based system in China to our physical tokens plus app in Singapore, plus to the framework that's been put across by Google and Apple in the US. That's on the population side. I think these things will only get better. They'll start linking with your health records. You'll start being able to see population trends proactively, and they might even link with wearable devices and such to see if you can start spotting a trend before it balloons out. On the more personal side, I think Matt started talking about the next layer of telemedicine, where the first generation of telemedicine, this goes back to the age of the astronauts when, NASA developed the telemedicine system, because what happens if your astronaut gets sick? The next step, of course, is to turn what is a glorified Skype call into something a little bit more productive. The first tier are some of these simple sensors. I think the next tier are more complex sensors like those you see in spirometry being now deployed at the home. So you go from more general to more specialized tests that are catered towards your particular condition. I'm seeing more and more sensors. I'm starting to see the multiplexing of sensors where you have, say, 9 biomarkers integrated into a single device. What I'd also really like to see, and we're starting to see, is at-home blood, saliva, and urine testing. And right now they're for relatively simple things. But I think that going forward, you're going to see the sensitivity increase. You're going to see the repertoire of different tests also increase, where you're now basically going to have test cards that you can put some bodily fluid on, and you'll see 20 or 30 different results from it. I think the question is, of course, around the sensitivity and specificity, which are relevant or not, and so forth. I think also we're overlooking a couple of things. Right now, a lot of physicians are still using their senses, be it direct or translated through electrons remotely to make a judgment call. And, you know, the doctors are quite good at making decisions based on their experiences, based on their problem-solving skills, but that doesn't necessarily mean that their decision-making capabilities are commensurate to their sensory perception. So the ability to give doctors superhuman hearing, superhuman touch, superhuman vision, I think is personally really exciting. I'm not sure you guys know this, but your smartphone camera, most of them these days, generate about 300 megabytes of data per second. You know, you've got 4 billion possible colors. You know, if you look at the red, green, blue, and alpha channels of the information that is passed onto your phone, can you as a doctor detect subtle changes? No, not with your naked eye, but your phone can. You know, as well as the whole broad range of frequencies in the auditory spectrum. Can you as a doctor consistently and objectively make a judgment call each and every time? And the answer is no. But if you're given an indicator, can you as a doctor then make a decision? So the thing that we're starting to see, and I think COVID has certainly accelerated, is a play towards the doctor's strengths, which is really taking evidence, problem solving, making a decision, and hopefully reducing a lot of the sources of variability and time wastage. I mean, the very fact that now you as a doctor can make a clinical assessment without having to spend 4 hours in traffic every day, I think is a huge benefit.
Yeah. Thank you, Joseph. And I am curious that given all the exciting things that have occurred both now and also what's in the very near future, and you're absolutely right, most of us doctors cannot tell 4 different colors, let alone 4 billion. How then are we preparing doctors for this change? I mean, COVID has brought doctors kicking and screaming into the digital era, but how are we thinking about getting doctors ready to get input almost like an AI triage with the system giving 3-4 potential really diagnosis, and then the doctor really, rather than starting from absolute scratch, really out of 4 choose 1 or something like that. Maybe Manuel, you're an eminent medical educator also. How in the Philippines, what's really happening around both the continuing professional education of the existing medical pool of and also the medical students both now and in the near future? And over to you, Manuel.
This is a fascinating discussion. Okay, and listening to Joseph and to Matt and of course to Christian, we're really looking at the world here. The fact that Joseph says that you are going to increase the perception, the sensory perceptions of doctors to do decision making beyond what they're normally trained to do. This is really fascinating. And it actually makes me reflect that medical education, particularly in this country, is really challenged to bring in this new technology and this training. I think the challenges are really, doctors are trained by doctors who were ahead of them 10, 15 years ago. Okay? Oftentimes, it's the student that's even more technologically conversant with things that are going on, particularly cutting edge. This is not to say that doctors are not, but when you then have doctors training medical students in an organized way across the country, and there are 50 medical schools in the Philippines, a great number of them in the National Capital Region and in urban areas. What you have is usually faculty members who are doctors training medical students the way they were trained before. Physical, the training of seeing patients on a person-to-person basis, using the stethoscope. Of course, there are advanced technologies, imaging and all of that, and that is taught too. But I think the challenge here is, how do you fast track it? Therefore, I'm fascinated with what went on in China. How do you get the broad population actually into this digital technology? And how do you get teachers to actually be so advanced that they can train students on this digital technology and to do this in large numbers? In the Philippines, we graduate about 4,000 doctors a year. Okay? And many of those doctors eventually work in hospitals. And then also, if you're looking at market conditions, the level of technology will essentially be the level of technology in your most modern hospitals. But I can see that technology is moving so fast. And how then does that advance in technology, that cutting edge, translate to the faculty members that have to train the next generation of doctors? And how do the hospitals and how does the health system build the infrastructure so that this technology gets adopted? I think what we have in the Philippines is, because of the infrastructure limitations, it's a large country, many places still remote and inaccessible, and the huge digital divide. You're seeing a situation where you're actually going to have a lot of, where it's the modernized, urbanized areas where you're going to see a lot of adaptation of this technology. And you're going to have large chunks of the population that are still going to be struggling with adapting this technology. Telemedicine there in the rural areas would be a great advance already. Picture a health physician in a remote place being connected, for example, to a center that can provide them input with treatment patients. And as all of this. So, I don't know if I answered your question, Jeremy.
No.
I think what is obvious here is the advance that government has to make to create a platform where you enable the adaptation of technology rather quickly and train your people, your human resources towards the use of technology across the board.
Yes, and Manuel, that's an excellent question. Can I turn to Matt and can I ask you, Matt, to speak about three groups, the general public, and in particular those in the rural areas, and really how the system and really got them to embrace digital health. Secondly, the senior doctors, the ones that Manuel talking about, who were educated in a very different world. And how do we get them ready so that they can be good trainers to the current generation? And then the third group, can you say a little about Chinese medical education today and really how they graduate and are ready to join WeDoc right away? And over to you, Matt.
Okay, before I answer the three questions, I want to add 3 points. Okay.
Yes,
number
please.
one, to vast adopt this telemedicine, you have to have insurance behind it. Okay. Originally, the telemedicine is only out of pocket. Basically, people paid for themselves. So this adoption is very slow. But once the insurance joined this force, then the adoption is very fast. Okay. So that's number one. Okay. The second thing is about the AI and the big data, use of the technology, right? And this, I will address the 3 questions you have together on this point. We have the AI engine sitting behind when doctor is doing the diagnosis. And it's on top of CDSS, okay? So when the doctors is collecting or, answering or actually asking the questions and collecting the answers, and also reading through these digital, the examination reports. The AI engine is also doing the same at the same time, and also making recommendations. This is so-called supervised learning, right? So the doctor is doing the things, and the AI is doing things behind the scene. Okay, so this is it will. I would say it will help the advance of medicine quickly when we have this kind of vast data and specialize in one disease category, right? So the third point I want to make is the telemedicine and the internet hospital. When we talk about this, or digital health system, is really creating a system that preventing you getting into sickness. So today's healthcare system is taking care of people when they get sick. But because of this internet-based system, when the patient is getting well, but the system can track them again, and also get into wherever the environment they are in, a workspace or home, etc. Right, and also advise them to have a healthy living. Okay, so these are the three things I think is changing, right? So now I'm answering your questions. In the remote area, because you know that we have those so-called mobile hospital that mounting. There are devices which is like a second double A hospital. We have triple A, double A, and A level hospital. The equipment is equivalent to a double A hospital that can send into the remote areas with one doctor and one nurse and one technician on board. Okay, going to the remote villages and towns. Okay. So this is one way. And when we talk about telemedicine, you have to think about online, offline together, and with those physical, movable, vehicles going to the remote area. Okay. So this is one thing. But when the village, the farmers, the villagers go into the local hospital, and when they get get diagnosis, they can use the telemedicine together with the major city hospitals. So they can do the diagnosis together, through that system. And for the education part, I think on the WeDoctor platform, we have the specialized areas of those famous doctors in the nation that are giving the free seminars, etc. And we record that. And there is just like a YouTube, right? You have those sections that for different category, people talk about their practices, etc. And this is becoming more and more popular.
I see. All right. Yeah, and maybe Matt, before you move on to talk, could you say a little about what are the capabilities or the equipment in a double A hospital?
Well, there are, the blood test, the urine test, ultrasound. For most recently, we even equipped a CT scanner on it because of COVID-19. So you basically doing that CT scanning. That's for a special request. But mostly, it can do 52 different category examination. And also it also connect with the patient's previous examination records, because there is a center of database for the EHR of each patient when they collected. So it's almost like it's a personal health gateway into your own health record.
I see. All right. No, great. That's very helpful. I am mindful that we are going to open to questions from the audience very soon. But maybe can I just take one point that Matt raised and go to Christian, which is about reimbursement and what have the providers in the Philippines been doing to engage with the government and with PhilHealth to get the reimbursement sorted out?
Well, it's a very it's a very politically
You can
loaded
be-
question. Yeah, given the
That's
current
why
health
I'm asking
situation.
you, Christian.
I'm going to be very polite about it. I mean, there's one good point is regulation quickly caught up, and like
Yes.
our existing telehealth laws were stuck somewhere 1950 traditional way of delivering healthcare in person, right? The DOH quickly, issued a memorandum circular to say, look, to enable teleconsultation, these are the guidelines. This is what you need to do in terms of data privacy for patients and so on, e-prescriptions quickly. The challenge for us, how will this carry over post-COVID-19? Or there will be a time after COVID-19. What's the implication for this? What will this regulation? In terms of reimbursements, it's an ongoing process, Jeremy, but right now, PhilHealth does not reimburse teleconsultations. Most HMOs don't reimburse teleconsultations. They offer them for the enrolled members as a sort of pre-screening process, but it's limited to their own platforms. It's so very many walled gardens that you walk through, so to say, but there's not a single regulatory approach. Telehealth consultation must be reimbursed, which, as you might agree, really led to the adoption of telehealth in the US. It was covered on the Medicare reimbursement schemes, right? All of a sudden, it was like first telehealth, then in person, right? So that we actually find out what is the right pathway for you through the healthcare system. I think that would be a perfect adoption for the Philippines as well, because a lot of patients struggling these days to actually find the right pathway for their care. Everybody goes straight to the specialist or the emergency rooms, which really burdens even public healthcare systems tremendously with wasted encounters, so to say, right? So if we have a reimbursement scheme, that would actually help to also establish this pathway. It would definitely give to the rise of telehealth. But so far, consultations are in early stage. There is some discussion going on, but given the current political turmoil around PhilHealth itself, I do think it will take a bit longer before we have this tied up.
Yeah. Thank you for the politically correct answer, Christian. Can I turn to Joseph, since he's not going to be heading to the Philippines anytime soon, but really, Joseph, there's an interesting question here on whether the Philippines should encourage homegrown versions of really WeDoc, or should it simply invite the WeDocs of this world to come into the really Philippines? And what are your thoughts around this?
I think the answer is both, but I think the challenge is the large health tech companies have their own large markets to deal with first. I mean, Dr. Wang mentioned that there are 200 plus million users, but last I checked, there are 1.4 billion people in China. So, it might be a question of priorities, and while the large tech companies are coming out, maybe there's an opportunity for Philippine companies to lay the groundwork and then work together, or for the investors like myself, get an exit when the big players come in and decide to roll everything up. One point I also want to raise really, really quickly is that I think it's unfair to put the entire burden on the doctors and the medical system, as well as the politicians, to fix the problem. I mean, Apple did society a great service by allowing an entire cohort of senior citizens to finally get connected to the internet in a simple and effective way. And I think we need to also remember that the user experience, the user interface, the usability of these technologies has to be designed in such a way that it is familiar to the healthcare practitioners in order to ease adoption. It's not just the healthcare system's problem. It's also the solution generators' challenge to get these things easy to use. And one thing that we actually try to really look for when we invest in a new technology is how familiar is it to an existing medical practice that is really just a bolt-on that adds a digital capability or remote capability on something that people are already used to. So the learning curve is much shallower, because the problem is you have a scarce resource. You have very few doctors, and they don't have time. They just don't have time. So don't make them work hard.
Okay, thank you. Caesar has put a very interesting question, given that COVID is and the whole digitalization, not just of healthcare, but of every industry. There's an opportunity to really repurpose and to reposition a lot of things. And the question Caesar specifically asked is really about malls, but I would broaden that to any infrastructure, any facilities that have seen their fortunes change very dramatically with really COVID-19, maybe karaoke lounges. But does it make sense to repurpose some of these? Because as I listen to Dr. Wang about the online-offline combination, do you think this could work in the Philippines? And really, Christian and really, Manuel, what are your thoughts around this? Because as really Caesar really pointed out earlier, the Philippines is desperately short of really healthcare professionals. Part of the reason is that you're a very large country. Part of the reason is that many doctors really head out overseas. But could an online-offline really proposition help to expand coverage and also to retain more doctors to care for patients inside the Philippines? Maybe Manuel, do you want to start, and then we'll go to Christian?
Yes. Well, I'm looking at the question of Cesar now, and I think it's already happening. That in the malls, they're already doing all of these chronic illness consultations. So that's happening already. And in fact,
Yes.
at the moment, during COVID-19, as we're opening up the economy, the availability of the doctor in the clinic of the malls is really draws the patients in. So I think more and more that there is a market there. I think as these mall-based clinics expand and do telemedicine, I think they're going to grow the business, because then people in the cities will find it more convenient to go to the mall, do additional thing there and see their doctor. And if they can't go to the mall, they can organize a telemedicine consult. And I think that's the business. And I don't know if Christian thinks that this is going to work.
No, if I may add this, whoever has been in the Philippines knows that malls are social spaces here. They're not for the pure purview of consumerism. They act as social spaces. So they're literally and naturally attract tons of people, right? We have mall-based clinics under the Healthway brand, and we are actually linking them to our digital ventures, right? What I think really works nicely online and offline is if I can book an appointment in the clinic. I know I want to go to the mall at 2 p.m. I have an appointment at 2:30. I walk into the clinic, right? It really helps with these new social distancing guidelines, with healthcare guidelines in terms of COVID-19. So what we actually see and what I think will happen is really that we link online and offline together to really drive convenience, right? I know I go to the mall, I can also book an appointment. I know the doctor is in, I can schedule my day. I think it's very important that actually we work around the patient's schedule rather than how it's mostly done today. The patient needs to adjust to our schedule, the doctor's schedule. We need to go to the way where the patient says, I'm ready to see a doctor at 2 p.m. Let's make this happen, right? And I think malls are a great outlet for this. It's just we need to build our infrastructure around it so that it's easy for consumers to actually schedule it at their fingertips, so to say, as we link digital infrastructure.
Yeah, and there was a question around insurance. Can I ask really Matt about the Chinese story as to how the insurance system caught up and decided to reimburse? Was it through the advocacy efforts of groups like really We Doctor, or can you describe what was the path that led to reimbursement as a useful case study for the Philippines?
Okay, actually, it's the insurance, especially the government social insurance, has to be forced into that. I mean, We Doctor or any other organization don't have that power. You can have many advocacy to talk about this, but it will not happen. It's only through the COVID-19 when Wuhan have about 400,000 chronic disease patients are locked into the home, and they run out medicine. They either stay at home and die, or they go out and die from COVID-19. Okay. So the government basically have a crisis on hand. Okay. And the telemedicine is a way to solve this problem. But you have to have the social insurance payment enabled in order for the medicine to be delivered at home. Okay, so it was through a crisis, and then quickly the government basically issued a policy, to enable, to basically saying the insurance need to pay it online. Okay, and then quickly the technology is available to identify the person, facial recognition or fingerprints, all these different technologies available to identify this patient is eligible for that insurance payment, etc. Right, and then through this crisis, and then suddenly it's the gate get opened up.
Okay, and are there lessons then for the Philippines? Christian, Manuel, what is the forcing function, right, that we saw in China? What's the path to this happening in the Philippines?
Consumer demand, Jeremy. Personally, change is driven by consumers, patients demanding it. I mean, we have seen a lot of technology advancement. Joseph pointed to some. Dr. Matt pointed to some. They're driven by consumer demand, right? Once people actually say, look, there needs to be a better way to do this, they come to healthcare providers, successful healthcare providers implement these models, regulators will listen and change. I think COVID-19 has been this forcing functions that regulators listen and look what is the market doing. We just really need to use this momentum to keep pushing. That is my opinion on this one, right? So but generally what we have seen is consumers demand it, there will be change that actually also implemented on the regulatory side.
Yeah, thanks. And maybe Manuel, could you also say a little about data? Because I really do not emphasize that there were 400,000 citizens in Wuhan who had chronic disease who couldn't gain access. What's the equivalent data-driven burning platform that we would see in the Philippines?
You know, this was a huge issue, Jeremy, particularly at the start of the epidemic.
Yes.
The database, the health information system, so that everybody that was tested got into the database and you could come out with your dashboards of information just to analyze what was going on. And so what actually happened was that the Department of Health, helped by the private sector, actually built this database. But in order to build the database, a number of things had to happen. First, you had to build the infrastructure of the testing laboratories. There was only one testing laboratory in March that was doing RT-PCR testing. After now 7-8 months, we now have about 140 in different parts of the country, okay, and a large portion of them in the national capital region. But that was a huge achievement, just to increase the number of labs to do the testing. But as they did the testing, then you had to collate the data, clean it, and analyze it, and then send it out. And that is not, and in fact, we have good analysis of the data, so we can track what is happening in the pandemic at the moment. But that has to continue to go on, particularly because this data has to get to the level of the local government. Local governments of municipalities of 50,000 people. That might be one case or two, but they have to be able to control any exponential potential if there is a case that... And they can only do that if they have good data. And so this has been the challenge. We're addressing it. We've gotten over a huge hump. As a result of this data, we're now connecting the mobile app to it. And so hopefully over the next months, we'll have a mobile app to track infections in the population.
Yeah. On this topic around data, we have been talking about in the Philippines COVID-specific data. What about the non-COVID related data? Because COVID will come and it will go, but the diabetes, the obesity, the hypertensions, they are here to stay with us. And frankly, if we look at the excess mortality data from many countries around the world, I would suspect that these, together with mental health, have been an even larger burden of disease. So maybe can I turn to Joseph as well as Christian to talk about how the routinely collected data through telehealth and other modalities can be used to help policymakers to make better decisions, to identify, yes, we need to do this, we need to change this reimbursement policy. Maybe Joseph, we can start with you, and any examples you can think of from any country in the world, then we'll go to Christian.
Yeah, I mean, you can't, as rightly stated earlier, you can't manage what you can't measure. And the nice thing is that you are starting to, I mean, I haven't seen any country just yet massively adopt an electronic medical record because of COVID. I feel like everything that has been built has been really, what's a nice way to put it other than duct tape and bubble gum? No, it's really fit for purpose, and I wonder whether this will catalyze more permanent and structured changes. Because if a country had a functioning health record before, it still has a functioning health record now, and the COVID statistics were bolted on top of that. You know, if you don't have it right now, you're not going to build it during a crisis. But now, after the crisis passes, you realize the importance of having it. So, the countries that have handled COVID well, it's no surprise that they have a national health record infrastructure in there before, and a lot of these countries are living in Asia or Nordics in Europe.
Okay. Yeah. All right. We are running out of time, so can I ask Christian to chime in and also give his thoughts on our last question? What is your hope for digital health in the Philippines?
Okay, I'm gonna compress it. Like, I mean, I think it's the part of the healthcare providers is educating our consumers, our patients, right? That whatever we applied and learned during the COVID-19 crisis applies to this kind of diseases you mentioned, right? We can treat them better, we can take better care of them in clinic setting as well at your home, right? What we really need to do, and that is the job of healthcare providers, doctors, to really educate patients. Look, these two work streams, or these two care streams, on premise, in your home, can work seamlessly together. It makes it easier for you, to improve your quality of life. Because at any given time, I'm not feeling well, or I feel my blood sugar is off, I can have lining up and before I get to see somebody, right? So once we drive this message home, I think that patients will actually understand, wow, this really improves my overall situations. For healthcare professionals, wow, I have access to the patient at any given time and can provide guidance, can check in. Joseph mentioned earlier, technology can pick up minor indicators, right, that the doctor on a video call won't even see. Be it, the video is not that great, but technology can pick this up. More important, it can pick it up 24/7. Right, and usually we only have this in hospitals where they measure. Now we can see minor changes instantly. Technology can assess it, give the doctor early warnings. Look, there's something happening. So we can catch certain diseases before they actually manifest themselves fully, right? Yeah. So to this one, I think there's a great hope for it. We just need to educate people. Yeah. What I hope for in the Philippines is the regulator steps up to the game, to the challenge, and brings telehealth into this formal healthcare system so that we can actually integrate it, public and private. Then the second one is we really need to integrate the systems. Continuity of care is right now happening in silos. Every healthcare provider is taking care of it itself. If I'm going to a different healthcare provider, I have to bring a stack of paper with me. Yeah. So it's up to the government to actually integrate these various assets so that post-COVID-19 we can easily move patients across.
Yeah, thank you, Christian. And really, Manuel, over to you. What is your hope for digital health in the Philippines?
I think, Jeremy, short, it's really modernizing the health system. It's modernizing PhilHealth operations, particularly as the social insurer. It's modernizing digital infrastructure in the country and the adaptation of this digital infrastructure. And everything should follow from that. And the hope are, of course, the drivers are the consumers, but of course the legislators and of course government. There have visionaries that are going to move this agenda forward and work with private sector in order to make this a reality going forward.
Yeah. Thank you. And Matt, you are not Filipino, so I won't ask you for your hope for the Philippines. But looking at the experience that China has had, what do you, if you could crystallize it in one lesson, what is the one lesson China has to share with the rest of the world about COVID-19 as it pertains to digital health?
I think, as many of the speakers said, the system has to be in place. The technology has to be ready, right? And the technology is ready. It's just that the policy has to catch up, right? Regulations has to catch up. The second thing is with this COVID-19, the one silver lining is that people realize what technology can do.
Yes.
And also it can take care of, really it's a digital health system. It's not a healthcare system. A digital health system means when you're healthy, stay healthy. And using the wearable device, and it's out of the hospital basically. When you are staying at home, and we can monitoring you 24/7 and give you advice on healthy living, so that we can prevent you get into the real hospital. This is, I think, the future.
All right, thank you. And last question for Joseph before we wrap up. Joseph, let's end on an optimistic note. How much money will you invest in the Philippines and why?
I think I'm at the point where it's our portfolio investments decision to figure out how much money they want to invest in the Philippines, which I think, we actually have quite a number of companies that are looking heavily into the Philippines. One of our companies, Reach 52, started in the Philippines and has most of its user base here. We believe there are tremendous opportunities for the health system here to move forward, tremendous opportunities to help the lives of the 100 million Filipinos get better, more affordable and higher quality healthcare. It's an exciting place full of wonderfully warm, hardworking, nice people that deserve and demand better health. And I think it's time we give it to them.
Thank you, Joseph. And on this note, I do hope that the last hour has been very helpful to all our audience, and really thank you very much to our four panelists. Very illuminating. Thank you for the candid really comments. Let me end off with a quote from Yoda. Do or not do, there is no try. And I agree with all of you that the Philippines deserves our very, very best shot. So ladies and gentlemen, thank you very much for joining us and have a good rest of the day. Thank you.
Thank
Thank you, Jeremy. Thank you,
Bye-bye.
everyone.
Bye-bye.
Bye.
Bye-bye, everybody.
Bye-bye.